Today we honor Dr. Hakaru Hashimoto, a Japanese surgeon known worldwide today by the thyroid disease that bears his name, Hashimoto's disease, a condition that causes hypothyroidism, a reduction in the function of the thyroid gland, and also causes goiter, which is an enlargement of the thyroid gland. The thyroid gland is an endocrine gland that is located in the lower portion of the neck, anterior to the trachea and inferior to the larynx. Hakaru Hashimoto was born in 1881 in the village of Iga, Japan, about 30 miles east of Nara, which was the first permanent capital of Japan. Hashimoto's family had practiced medicine for 4 generations. After graduating from high school in Kyoto, he studied medicine at the Fukuoka Medical College, a part of the Kyushu Imperial University, and graduated in 1907. He was invited by his professor of surgery, Dr. Hayari Miyake, to stay in Fukuoka and continue his surgical training, which he completed in 1912. Interestingly, Dr. Hashimoto did his surgical training while Dr. Sunao Tawada, the discoverer of the heart's atrioventricular node, was a professor of pathology at the same university. I'm sure their paths crossed more than once. During his surgical training, Dr. Hashimoto examined the features of 4 unusual goiter cases. All 4 women over 40 which had had a partial thyroidectomy, that is, the partial removal of the thyroid gland. At the time, it was thought by some that these women had an initial stage of what's known as Riedel's thyroiditis, which presents with a rock-hard thyroid gland that adheres to the surrounding tissues, making surgery very difficult. But this was not the case in these patients. They were different. Dr. Hashimoto noted that the histology of the gland in these patients was similar to Graves' disease, a type of hyperthyroidism, that is, excessive production of thyroid hormones. But both conditions were clinically different. These 4 women were different. Under the guidance of Professor Miyake, he reported his findings and named this condition struma lymphomatosa, publishing in 1912 an article in German titled On the Lymphomatous Change of the Thyroid Gland in the journal Archives of Clinical Surgery. Dr. Hashimoto left Japan for Göttingen University in Germany to study with Professor Kaufmann, chairman of the Department of Pathology, and Hashimoto worked on tuberculosis of the urinary tract. After this, he left for London in 1914 after the outbreak of World War I, where he studied for 1 more year before returning to Japan. In 1916, he set up a surgical clinic at his own home. Unfortunately, he contracted typhoid fever while working against an outbreak in his district. Dr. Hashimoto died in January 1934. He was only 52 years old. His discovery opened avenues of research leading to great advances in endocrinology and immunology, among others. Hashimoto's disease was finally recognized as a clinical entity by the end of the 1930s, and the term has been widely used since then. So, on a personal note, this article was suggested and written by my good friend and classmate, Dr. Roberto Villaseca Najarian, an endocrinologist in Santiago, Chile. Thanks for watching this video, and make sure you subscribe to our YouTube channel. See you soon.